Hello and welcome to our next installment of Doc Talk at Good Samaritan Hospital. I'm Dr. Rich Briones. I'm the Chief Medical Officer here at Good Samaritan Hospital, and I'm pleased to be joined by one of our newest members of our independent medical staff, Dr. Harmeet Bedi. So maybe start with telling us a little bit about who you are and, what do you do?
I'm an interventional pulmonologist and the director of interventional pulmonology at Stanford University. I've been there for 8 years, and I pretty much focus on lung cancer related issues, complications of cancer within the lungs, and various types of procedures that are performed there.
Wonderful. Well, you've been quite the addition here to the Good Samaritan Hospital family. And I know that one of the things that we really like to do, as I stated at the outset, is dispel one of the myths that may be out there. I think in general, the population at large believes perhaps that lung cancer is a disease of the smoking population. Is that the case?
That's actually not the case completely. Historically, we've known that lung cancer has a strong link to cigarette smoking. However, over the last 2 decades, we've seen a new form of lung cancer kind of emerge, really in the Asian population. We're seeing a lot of patients, predominantly females that are never smokers, that are in their 30s, 40s, and 50s getting diagnosed with lung cancers, in addition to males as well that don't have any smoking history. We do know that there are a few variants of lung cancer that don't have any smoking link. And that's been a really hot topic because a lot of different medicines have been developed for that subtype of lung cancers.
Some of the things that we've been doing here at Good Samaritan Hospital, we have patients that come in to see us for various ailments, and as a part of their routine therapy, they undergo a CAT scan. And it's not unusual that sometimes those CAT scans come back with some interesting findings.
So lung nodules, or a spot in the lungs, is they're commonly found accidentally just from getting additional scans. So you come into the ER with abdominal pain and they scan your belly, and usually on a belly scan they're going to get the bottom of the lungs. And what ends up being found sometimes are these tiny spots. When these tiny spots are found, it usually gets funneled to a doctor like myself, a lung specialist. We are proud to work with Good Sam here with your guys' robotic technology. Over the last few years, a new technology has emerged known as a robotic bronchoscope. It's basically a catheter that is robotically driven through the mouth, navigates into the lungs using a GPS system, similar to like a Google Maps. We put in the coordinates of where we want to go, and then we navigate towards that target. We're very fortunate to partner with you guys and also use your cath lab and use advanced 3D imaging systems to help us to get to these really tiny locations, and then use confirmatory imaging to confirm that our needle is in the right position before we take a biopsy. And the combination of this robot that is here at Good Sam, along with the 3D imaging, allows us to have the best technology available to diagnose the smallest and hardest spots in the lungs. And it's currently, it's really going to be the future technology that kind of exists out there. Most hospitals don't have this capability, and we're very proud to showcase that over here. And I just wanted to add, in addition to biopsying the actual lung nodule, within the same procedure, we can biopsy the lymph nodes and complete a staging procedure. Historically, people would have a needle inserted through their chest, and then they would have to go to a pulmonologist to get the lymph node sampled as a second procedure. With this procedure, we can do everything in one go altogether. Also with a lower complication rate compared to other biopsy techniques where the needle goes through the chest, that's known to have a higher risk of getting a lung collapse. So there are safety benefits as well too.
Well, I know that we, as I said at the outset, could not be more delighted to have you in our midst, in our community. So thank you for joining us today.
Yes.
Great. All right.